Hi, my name is Cara DeBenedictis, and this is my genetics genomics presentation on Fragile X syndrome. Now, a little bit about Fragile X syndrome. It is a genetic condition that causes a range of developmental problems, including learning disabilities and cognitive impairment. Some symptoms of Fragile X syndrome can include delayed development of speech and language, mild to moderate intellectual disabilities, anxiety and hyperactive behavior such as fidgeting or impulsive actions, attention deficit disorder or ADD, features of autism spectrum disorder, and seizures and other medical issues. Some of the specific physical characteristics that you can see with patients with Fragile X syndrome are long and narrow faces, large ears, prominent jaw and prominent forehead, unusually flexible fingers, flat feet, and enlarged testicles after puberty. Some of the medical problems seen with Fragile X syndrome are otitis media. 85% of Fragile X syndrome patients have one diagnosed episode of otitis media. Seizures are seen, males usually with a higher rate than females. Mitral valve prolapse can be seen. Gastrointestinal problems such as diarrhea or GERD have been associated with Fragile X syndrome. Sleep issues and specific obstructive sleep apnea have been seen. Strabismus and tic disorders are also associated with Fragile X syndrome. The epidemiology of Fragile X syndrome is it is a mutation in the FMR1 gene, and that causes Fragile X syndrome. This specific FMR1 gene provides instructions on making the protein FMR, which helps regulate the production of other proteins that play a role in the development of synapses. And synapses are critical for relaying nerve impulses, and a loss or a shortage of these proteins disrupts nervous system functions. And these nervous system disruptions then lead to the signs and symptoms associated with Fragile X syndrome. Fragile X syndrome is an inherited X-linked dominant disease. It occurs in approximately 1 in 4,000 males and 1 in 8,000 females. You can have premutation carriers, and those are males and females with not necessarily a normal FMR1 gene, but not the full mutation associated with Fragile X syndrome. Most of these premutation carriers are intellectually normal. However, some of these people may have mild versions of the physical and emotional features seen in Fragile X syndrome. A woman with the premutation has an increased risk of having a child with Fragile X syndrome. However, a male with the premutation does not pass along the premutation well to the next generation. And of note, because it is an X-linked dominant disease, a male can only pass a mutation or a premutation to a daughter because their sons receive a male's Y chromosome. Diagnostic testing for Fragile X syndrome is with a molecular genetic test of the FMR1 gene, and prenatal genetic testing is available. The screening recommendations for Fragile X syndrome should be considered in the following populations: with individuals with mental retardation or developmental delay, autism, and especially if they also display physical or behavioral characteristics of Fragile X syndrome. You should test if a person has a family history of Fragile X syndrome or relatives with undiagnosed mental retardation. Those seeking reproductive counseling who have a family history of Fragile X syndrome or an undiagnosed mental retardation can be tested for Fragile X syndrome. And fetuses of known carrier mothers should be genetically tested for Fragile X syndrome. There is not just one treatment for Fragile X syndrome, and there is no cure for this genetic disease. However, a combination of educational treatment, supportive services, and medication have the best chance at utilizing one's skills and abilities. And medical treatment to prevent further medical complications of the medical problems noted earlier is also recommended. So some examples of some educational treatment. Most Fragile X syndrome children will benefit from a specialized educational plan that is tailored to the child's need. Special education is sometimes a good option for this patient population. However, some Fragile X students can be in an inclusive classroom. But regardless of the choice, every child normally qualifies for an individualized education plan to help a child reach their potential and their goals. The National Fragile X Foundation is a great resource that has lesson planning guides to help parents and their teachers best teach Fragile X syndrome students. In addition to educational help, a child with Fragile X syndrome will benefit from other specialty therapies. Some examples are a speech language therapist who can help a Fragile X syndrome person with pronunciation of words and sentences, how to use their language effectively, and how to slow their speech. Occupational therapists can be used in the Fragile X population to help with activities of daily living that best fit a person's needs and desires. Physical therapists can help a person with improving motor control, posture, and balance, as those can be impaired with Fragile X syndrome. And then behavioral therapists can be also used with Fragile X patients to help with different behavioral issues and to try to create ways for avoiding or preventing acting out situations that can be commonly seen in children specifically, or all patients alike who have Fragile X syndrome. Some of the medication treatments available are there are no FDA approved medications for the specific treatment of Fragile X. However, there are some, and frankly a lot are used to help with symptom management. So for seizures and mood instability, which is seen commonly in the Fragile X syndrome population, you can give carbamazepine, valproic acid, lithium, gabapentin, lamotrigine, topiramate, phenobarbital, and phenytoin. You can see ADHD or ADD, depending on which kind, in Fragile X patients. And you can give methylphenidate, L-L-carnitine, venlafaxine, imidazine, and folic acid to help with those hyperactivity and attention deficit symptoms. Hypoarousal sensory overstimulation, which is often accompanied by ADD or ADHD. You can give clonidine or guaifenesin for that. And like earlier we said with behavioral modifications, for aggression intermittent explosive disorder or OCD, you can give fluoxetine, sertraline, citalopram, paroxetine, fluvoxamine, risperidone, and olanzapine. And sleep disturbances, which I mentioned earlier, is a medical side effect or a result of Fragile X syndrome. You can give trazodone or melatonin to help with those sleep disturbances. Like I mentioned earlier, there are some medical results of Fragile X syndrome. So whatever medical symptoms the patient presents with will guide the clinician's treatment modalities. So like I mentioned earlier, otitis media is seen often in this patient population, so antibiotic treatment is recommended. You also want to stress the importance of immunizations to the parents and the patients of Fragile X syndrome so that they are having a higher immune response to bacteria or viruses that could attack them. Seizures are seen in this patient population, so you want to make sure that they are on medication for anti-seizure prophylaxis, and also you want to refer them to neurology. Mitral valve prolapse is seen in this disease, so you want to make sure that surveillance is recommended, and in severe cases, surgery may be necessary. They also need to be referred to cardiology if they have this side effect. Gastrointestinal problems such as diarrhea or GERD is seen, and you want to prescribe medications to help with those symptoms and also encourage diet changes as well. Sleep and sleep disturbances is seen often in this patient population. So like I mentioned earlier, a medication treatment such as trazodone or melatonin is recommended, and also behavioral modifications such as creating good bedtime habits is recommended to help with this. Obstructive sleep apnea is seen, especially in Fragile X syndrome children. So the first step is going to be medical treatment. And then if that does not work, you can move to drainage of nasal secretions. And finally, if that does not help with the obstructive sleep apnea, surgery is an option, which would be an adenoidectomy with or without a tonsillectomy. Strabismus is seen in this patient population. You want to offer visual training exercises or surgery if needed. The main thing, though, is you want to refer these patients to ophthalmology by age 4 so that they are screened for this. And tic disorders can be seen with Fragile X syndrome patients. Sometimes it is the result of all of the medication they are on for the multiple different other medical issues that they're having. And normally, treatment is not needed unless the case is severe, and medication can be used in that situation. There is not just one clinical guideline to treat Fragile X syndrome due to the complexity of the disease. There are behavioral issues, cognitive issues, and medical issues that all have different guidelines of treatment. The main thing is early management is key for all of these symptoms of Fragile X syndrome. The future looks bright for not only reversing the cognitive and behavioral problems, but also many of the medical problems associated with Fragile X syndrome with targeted treatment, and that was in one of the scholarly articles I read. So, encouraging news. There are many available resources out there for family members of people diagnosed with Fragile X syndrome. There are many websites out there with helpful information. 2 of them are listed below. One of them is the National Institute of Health website, which I referenced often and has a lot of great resources. The CDC also has a great evidence-based website that has a lot of good information about the disease as well. The National Fragile X Foundation website has an incredible amount of detailed resources ranging from educational tools to medication and to adulthood planning, which not every resource that I saw had a lot of information about. So the National Fragile X Foundation is a great resource to give our patients as well. They also mentioned that there are many Fragile X clinics across America to provide individuals and families affected by Fragile X with comprehensive evaluation and treatment recommendations. So that can also be something that you can point our patients and their families to. So in conclusion, Fragile X syndrome is a disease that cannot be cured or avoided. However, support is key to this diagnosis. There are many resources available, and the number one thing we can do as a healthcare provider is provide our patients with genetic counseling before and during a pregnancy, offering resources after a child is born with Fragile X syndrome, and then to continually support a family with various medical treatment and medications, and then offering continued resources throughout the patient's life to help them deal with this genetic disease. And there are my references. Thank you very much.